Good morning to all those who make this broadcast possible, to Gisela, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of one person with COVID-19 yesterday. The patient was a 70-year-old woman from the municipality of Cárdenas, Matanzas province. She was a confirmed case contact and suffering from pre-existing health conditions. The patient began to develop symptoms on September the 18th and was admitted to hospital before being transferred to the intensive care unit where she stayed for the next 12 days. Her body's response to the virus was unstable, and she suffered a series of serious complications. On October the 4th, she went into cardiac arrest, and after 40 minutes trying to revive her, sadly died. We offer our condolences to the family and friends of the deceased. Today, 4,573 people are hospitalized in Cuba. 3,349 are under observation. There are 691 suspected cases and 488 confirmed active cases. Yesterday, we processed 7,334 samples in our various molecular biology laboratories. 2,189 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 907 in Havana's Hygiene, Epidemiology and Microbiology Center, 775 in Villa Clares, 379 in Santiago de Cubas, 470 in the Genetic Engineering and Biotechnology Center Lab, 419 in the Hermanos Almahedas Hospital Laboratory, 412 in the Molecular Immunology Center, 382 in the Naval Hospital, 368 in the Manuel Fajardo Hospital, 335 in the Civil Defense Laboratories, 316 in the Fructuoso Rodriguez Hospital, 300 in the ICA laboratories, and 82 in Ciego de Avila's recently opened molecular biology laboratory. Of the 7,334 samples processed, 36 tested positive for COVID-19. That's 36 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 651,035, of which 5,845, or 0.9% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Pinar del Rio, 154, the most from Havana with 4,043, Mayabeque, 313, Matanzas, 262, Cienfuegos, 120, Villa Clara, 106, Sancti Spiritus, 1,192, Ciego de Avila, 548, Camagüey, 159, Holguín, 153, Santiago de Cuba, 92, Guantánamo, 79, and so on and so forth from all of the country's territories. All of the 36 positive cases diagnosed yesterday are Cubans and the result of local transmission, meaning that there were no imported cases diagnosed yesterday. 34 of the 36 positive cases are confirmed case contacts. This means that 91.5% of all cases on the island since the pandemic began have had contact with someone who previously tested positive for the virus. It was not possible to determine the source of infection in 2 cases diagnosed yesterday. This means that the source of infection in 50 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for COVID-19 contracted it abroad, meaning that imported cases remain at 446. Of the 36 diagnosed cases yesterday, 19 are male for 51.1% of all cases, and 17 are female, representing 48.9% of all diagnosed cases on the island. 19 or 52.7% of the 36 cases yesterday were asymptomatic at the time of testing. Overall, 60.9% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 70.3% of cases diagnosed over the last 15 days. By age group, 6 positive cases diagnosed yesterday are under the age of 20, all of which are under 18 years of age, for a total of 648 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 554, or 85.5%, have recovered from the virus and been discharged from hospital. Meanwhile, 9 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 17 cases are between 40 and 59, and 4 are over the age of 60. Of the 36 diagnosed cases yesterday, 23 belong to Sancti Spiritus, 7 to Havana, 3 to Ciego de Ávila, 2 to Villa Clara, and 1 case to Artemisa. The case from Artemisa belongs to the municipality of San Cristobal. The 7 cases diagnosed in Havana belong to the municipalities of Cotorro with 5, Centro Habana 1, and 1 case to 10 de Octubre. The 2 cases from Villa Clara belong to the municipalities of Santa Clara with 1 case and Camajuaní also with 1 case. The 23 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 15 and Trinidad with 8 cases. Finally, the 3 cases from Ciego de Ávila all belong to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 58.51. Sancti Spiritus follows with a rate of 26.61, then Havana with 14.33, Matanzas has a rate of 6.67, Mayabeque 2.34, Artemisa 1.55, Camagüey 0.39, Villa Clara 0.26, and Holguín with a rate of 0.10. Cuba's rate therefore stands at 6.68 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,845 people who have been diagnosed with the virus thus far in Cuba, 488, or 8.34%, are active hospitalized cases. Of these, 487, or 99.7%, are clinically stable. Yesterday, one person died as a result of the virus, meaning that the COVID-19 death toll on the island rises to 123, with a mortality rate of 2.10%, lower than the global rate of 2.96%, and the regional rate, which stands at 3.33%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 87 people were discharged from hospital, a positive result when compared with the number of confirmed cases yesterday. 1 person was discharged from hospital in Artemisa, 53 in Havana, 13 in Matanzas, 2 in Sancti Spiritus, and 18 in Ciego de Ávila. This means that, to date, 5,232 people, or 89.5% of all confirmed cases in Cuba, have recovered from the virus. Today, 1 patient continues to be in a critical state in hospital in Matanzas. Yesterday, 4 serious patients passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 306,241 people were diagnosed with the virus, for a total of 34,986,502 confirmed cases since the start of the pandemic. Yesterday, 4,715 people died of the virus worldwide, for a total of 1,034,240 COVID-19 fatalities, and a mortality rate of 2.96%. The region of the Americas, which accounts for 49.04% of all cases worldwide, reported 113,824 new cases yesterday, for a total of 17,157,223 people to have been diagnosed with the virus. Meanwhile, 2,439 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 571,769, and a mortality rate of 3.33%. The United States continues to top the list of countries worst affected by the pandemic, with 7,382,944 confirmed cases, and over 209,000 COVID-19 fatalities. Then comes India with 6,549,373 cases. Then Brazil with 4,906,833 cases and 145,987 COVID-19 deaths. And in 4th place comes Russia with 1,204,502 confirmed cases and 21,251 deaths. From the Americas, after the United States and Brazil, comes Colombia, Peru, Argentina, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, and Costa Rica. These are the countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. Regarding mortality rates, Mexico has the highest with 10.41%, then Ecuador with 8.26%, and Bolivia with 5.91%. This is the information we have on the behavior of the pandemic in Cuba and the world.